Hello, this is Dr. Ford Brewer with heart attack, stroke, cancer, disability prevention. Why depend on a cure when you can prevent it in the first place? Today we're talking about hormonal or insulin theory of weight gain. I'm doing a series on that right now since weight gain and weight management is such an important part of prevention of heart attack and stroke and cancer and diabetes. I reviewed recently a book by Gary Taubes called Good Calories, Bad Calories. It goes into the insulin theory of weight gain. In fact, several of Mr. Taubes, maybe most of Mr. Taubes' books have been about that theory, the insulin theory of weight gain. Before we talk about the mechanism of that theory, let's just set a context in our own mind. Let's compare a typical teenager to a typical baby boomer or middle-ager. Which one is heavier? Well, I know that there's an obesity epidemic going on and that it's even hitting the teenage population, but I would also say, look, that exception proves the rule. We expect teenagers to be thin, we expect them to be active, and we expect middle-aged and older to be heavier and slower and less active. Let's also think about food as well. I mean, some older people eat a lot more, but typically your teenager will have a bigger appetite as well. So what's going on here? The teenager can eat more, they weigh less, they're more active, all compared to an older person. Well, I think we all know, it's very obvious. It's their hormones. So if you can see that kind of hormonal difference, driving appetite, driving weight set point, driving activity levels between large demographics like that, why can't you see it in individuals? And I think you can. Now, so just a brief discussion about the mechanism or theoretical mechanism behind the hormonal or insulin theory of weight gain. So the theory goes like this. It's not so much fat in the diet, and it's clearly not so much the precipitating event is that you eat too much, therefore you get fat. That's what we're typically told, and that is the common sense logic. Maybe this is an area where common sense logic sometimes doesn't work or often doesn't work. And in fact, like I mentioned, Gary Taubes is not the first one to come up with this theory. Google it on the internet. You'll see a lot of information about the insulin theory of weight management or the hormonal theory of weight management. And in fact, I got this off of the internet, and it helps to understand. So basically, it's not that we eat too much, therefore we get fat. It's that we get fat, and therefore we eat too much. How does that happen? So you eat carbohydrates. Carbohydrates increase the blood glucose level. The blood glucose level then increases insulin. Insulin shuts down fat burning and actually stimulates fat deposition. And as you get fat, then you eat too much and you exercise too little. Now, again, is that true, or is that just an excuse for people to get fat? I think there are clearly environmental issues. There are clearly behavioral issues in terms of dietary habits. But again, that's not what this video is about. This video is about the hormonal theory. Another way of looking at it is this. If you say, okay, when you have high insulin from eating, and again, eating carbs, you're going to have periods of your day. This is a day. These are the 3 meal times, and this is the sleep time. So when you have these periods of high insulin, you're cutting down the body's ability and metabolism of burning fat. So the more area under this part of the curve, the heavier you're going to get. And just think about patients that have insulin resistance, or they have high blood glucose levels during a major portion of the day. Again, what would you under this theory? What would you expect in terms of their weight? You'd expect weight gain. Speaking of insulin-resistant individuals, let's look at another concept in this area. This is normal blood glucose and normal intracellular glucose. Intracellular means glucose inside the cells. But if someone is insulin resistant, they can't get that sugar or glucose from the blood into the cells. So the cells are constantly starved of glucose, maybe making the individual hungry, even though the blood glucose level is high. So this gets to the discussion of metformin. You remember on a couple of other videos I talked about the anti-aging drug, TAME. TAME is a study called TAME, stands for taking or targeting aging with metformin. And here's the Bloomberg Business Week cover with a lady looking at her 173rd birthday. Now, again, what's all that about and what's the connection? Both of these are talking about glucose metabolism, both of these topics. The TAME study is not some wild idea that a crazy individual cooked up. The TAME study was developed by meetings of large groups of gerontologists, doctors that work all day, every day with aging individuals. They said, what is the major thing that causes aging in the human population? And it is glucose metabolism. So they came up with the idea, we know that metformin has a positive impact on the breakdown of human glucose metabolism. We also know a lot about the mechanisms, mTOR enzymes and AMPK. So let's try actually just giving that on a routine basis, putting it in the water for middle-aged people. Now, let's get back to what this means for weight loss. If you Google it, you'll see metformin is used quite often for weight loss, especially with insulin-resistant individuals. There's another group of patients for whom metformin has a big impact on weight loss. That's younger women with polycystic ovary syndrome, PCOS. Again, similar issues, maybe connecting some dots that haven't been connected that well so far. We'll be looking at this a little bit deeper later.